it's your meeting. We're here to do some facilitation, but it's an opportunity for you to share information and then talk about your projects, which we're looking forward to hearing more about, and being able to collaborate with your colleagues and partners.
Essentially, we're here because you're developing plans for improving your smoke-free laws. So the purpose is to spend time talking more personally and individually with some of the people in Scotland who've had practical experience recently in implementing and enforcing smoke-free policy. We've got different perspectives here. We've got government perspective and NGO perspective.
And would like to welcome you all to Edinburgh and to Scotland, and admire your determination to continue working hard after 2 days of intensive conferencing. We were very successful in Scotland to get comprehensive smoke-free legislation for Scotland. And Ash Scotland did the research to look at what had been published on what was effective in smoke-free legislation, to find out from other countries what had been done and how it had evaluated and what were the issues, and to really push government to make comprehensive legislation. We brought together a very coordinated campaign where we developed shared messages and shared common statistics, so when any of the organisations did press work, they were using the same messages, the same statistics. And I was delighted to see the 17% reduction in cardiac admissions to hospitals in Scotland in the year after legislation was introduced, compared to about 2 or 3% per year in the 10 years preceding.
How long is Scottish and Ash Scott is working on this particular program? How long? 5 years, 10 years?
Ash Scotland, it took 10 years from our starting our policy that we wanted smoke-free legislation to get smoke-free legislation. 10 years. But the actual campaign was live and very active for 5 years.
We were asked to implement the law at a local level, so although the Scottish law had been introduced, it took a lot of work from local workers, health workers, to implement that, to put case studies together, to get media interest, and all the media companies wanted local case studies, and we had to provide those. We also have to achieve targets to reduce smoking prevalence, so the government sets us targets in our local health area. We have to achieve them.
One question is that what are the constraints you are seeing while implementing so many?
The pubs and clubs and restaurants were the biggest challenge to all of the smoking legislation work, so I think we've had to overcome that.
Our aim was for compliance, 100% compliance from day one. Our research showed us that people saw passive smoking as a nuisance, not as a killer. But passive smoking is a killer, it's not just a nuisance. We had to take them on that journey and get them to believe in it in order to get the compliance.
Other people smoke is a nuisance. Having to go to hospital, that's a nuisance. Chemotherapy is a nuisance. So is losing your hair. Dying. That's a bit of a nuisance as well.
Passive smoking isn't just a nuisance, it's a killer. From the 26th of March, smoking will be banned in all of Scotland's enclosed public places.
And that ran and ran literally for months.
And what was the response from a receiver side? What was the success rate?
There was virtually 100% compliance. If people weren't complying, then it hadn't worked. But we saw from the monthly returns that people were aware of the date coming up, and that public support for it was increasing. So, we could see that our communications were doing their job. And as I say, on the day, the compliance level was so high that I have to say that we see it as being a successful outcome.
Did you observe any parallel attempt of the industry to did you had to counter that at any point?
Oh, it was very ferocious. I mean, they took out advertising space. and they were, saying that this was going to be the death of the licensed trade. They said that it was against people's human rights to not allow them to smoke. So they did that through advertising, but they also used newspapers that were more sympathetic to them, or not so much sympathetic to them, but less supportive of government, shall we say.
In Scotland, we only had 6 weeks to prepare for this legislation coming in. That's all the time we had, and we managed to get round about 4,000 businesses in that time. 26th of March this ban came in at 6 o'clock in the morning. Policy is only as good as the enforcement that can be adapted to the policy. Premises which we thought were going to breach this legislation was split up into high, medium and low risk. The majority of the premises that were going to we thought would break this legislation, were in the high risk. And we already had what we call a grip of these premises because they required a licence. If they breached any licensing legislation, we could report them to the board, and really any penalty that you imposed for smoking was minor compared to what the board could do to them. The boards that we have in place could close them down and they could lose their business. We only have 2 officers at the moment enforcing this legislation because it's so successful, but on a daily basis in Edinburgh we have 140 environmental health professionals, and all officers, when doing one particular visit, will check for signs of smoking. If we went to a public house and 30 people were smoking, we would ignore the smokers. We're not interested in them. It's the person in charge. If he refused to stop the people smoking, as I mentioned, we have a licensing committee, he'd go in front of the licensing committee and he'd probably lose his licence. Week 1 of the ban, 200 calls. By week 10, calls were non-existent about people smoking. So it only took 10 weeks for people to adapt here. Only 25% of the population smoke, so 75% were already non-smokers. And it's the most popular piece of legislation ever, and a chance to really improve the health of our nation, definitely.